Number 1. The lobotomy. Experiments. Imagine having a family member who's depressed, anxious, or just a bit too difficult to deal with. Now imagine the doctor's solution is to shove an ice pick through their eye socket and scramble their brain. That's exactly what happened to 40,000 Americans between 1935 and 1967. The year was 1935 when António Egas Moniz, a respected Portuguese neurologist and university professor, performed the first lobotomy on a human. But it was Walter Freeman, an American neurologist with zero surgical training, who turned this into a medical assembly line. In 1946, Freeman invented what he called the transorbital lobotomy. No operating room needed, no sterile technique, just an office, an ice pick, and about 10 minutes. Here's how it worked. Freeman would sedate patients with electroshock therapy. While they were unconscious, he'd pull up their upper eyelid, position a modified ice pick above the eyeball, and tap it with a hammer to break through the thin orbital bone. Then he'd shove it 7 centimeters into their frontal lobe and sweep it side to side, severing the connections that made them, well, them. Repeat on the other eye. Done. Patients woke up with characteristic black eyes and could walk out the same day. Freeman even converted a van into a traveling lobotomobile, driving to state hospitals and performing 25 lobotomies in a single day. His victims weren't just severely mentally ill patients with schizophrenia or depression. They were difficult housewives, children as young as 4 years old, and anyone deemed problematic. Rosemary Kennedy, President Kennedy's sister, was lobotomized at age 23. She went from mildly intellectually disabled to completely incapacitated, requiring full-time care for the remaining 63 years of her life. Between 5 and 10% of patients died immediately. Those who survived, about half became docile and manageable, which Freeman called success, but they'd lost their personality, creativity, and independence. The other half showed no improvement or ended up in vegetative states. 20 to 30% developed seizures for life. Freeman personally performed 3,500 lobotomies over 3 decades. His last patient died from a brain hemorrhage during the procedure in 1967. Only then were his surgical privileges finally revoked, though he kept his medical license until death. Meanwhile, Moniz had won the Nobel Prize in 1949. Neither man faced criminal prosecution despite the deaths. The procedure was eventually replaced by antipsychotic medications in the 1950s, but the damage was done. 40 to 50,000 Americans had their brains deliberately destroyed. The lobotomy experiments did lead to major changes, though: informed consent requirements, psychiatric patient rights, and strict regulation of psychosurgery. Today, the lobotomy stands as one of medicine's greatest atrocities, a reminder that just because something technically works doesn't mean it should ever be done. Number 2. Forsman's heart catheter self-experiment. Every modern cardiac procedure, from pacemaker insertions to angioplasty, exists because a 25-year-old doctor decided to trick a nurse and thread a tube into his own heart. This is the story of Werner Forsman and the experiment that destroyed his career but saved millions of lives. The year was 1929 in Eberswalde, Germany. Forsman was a junior surgical resident who wanted to prove that threading a catheter directly into the human heart was possible. Animal experiments had shown it could work, but senior doctors refused to allow human trials. They thought it was too dangerous, too reckless. So Forsman decided to do it anyway. He approached Gerda Dietzen, a 19-year-old operating room nurse, and convinced her the procedure was safe. She agreed to help, believing she would be the test subject. Forsman strapped her to the operating table and sterilized her arm, preparing her for the catheterization. Then, while she was restrained and unable to intervene, he performed the procedure on himself instead. She had to watch the entire experiment, helpless. Forsman made a small incision in his own left arm at the elbow crease, inserted a 65-centimeter urological catheter into his vein, and advanced it 35 centimeters toward his heart. He felt a warm sensation when it entered his right atrium. Then, with the catheter still dangling from his arm, he walked down 2 floors to the X-ray department. Nurse Ditson followed, distressed. The X-ray confirmed what he'd done. The catheter tip was sitting inside his beating heart. He'd threaded a tube through his veins into his cardiac chamber and survived. His boss was furious, called it a stunt. Forsman was dismissed from the hospital for unethical behavior, and his career in cardiology was effectively over. He eventually became a rural general practitioner, spending decades in obscurity. But here's the twist. In the 1940s, American researchers expanded Forsman's technique into a standard diagnostic procedure. By 1956, 27 years after that first experiment, Forsman shared the Nobel Prize in Physiology or Medicine. The man who'd been fired for recklessness had founded modern interventional cardiology. Today, over 1 million cardiac catheterizations are performed annually worldwide. Angioplasty, coronary stents, pacemaker insertions, all impossible without Forsman's self-experiment. He faced no legal consequences at any point, and millions of lives have been saved by the technique he pioneered while deceiving a teenage nurse. Number 3. The blood type experiments. Every time someone gets a blood transfusion, undergoes surgery, or survives a car accident, they owe their life to experiments conducted on hundreds of unwitting hospital patients in 1900. Before Karl Landsteiner figured out blood types, transfusions were basically Russian roulette. About half the patients died. Their blood would clump inside their veins, causing organ failure, blood clots, and kidney shutdown. But nobody knew why. Landsteiner was a junior pathologist at the University of Vienna, working under the director of the Pathological Anatomical Institute. In 1900, he started with a simple experiment. He drew blood from himself and 5 laboratory colleagues, separated the red blood cells from the serum, and started mixing them together in different combinations. Under his microscope, he watched something fascinating. Some combinations stayed separate and normal. Others clumped together immediately, the cells sticking to each other in deadly clusters. He discovered that human blood came in different types, and mixing the wrong types together would kill you. But to confirm this pattern held across larger populations, Landsteiner needed more subjects. That's where hospital patients came in. He tested hundreds of individuals, surgical patients, psychiatric ward patients, postpartum women. These were lower status hospital patients, people who had no ability to refuse and no idea they were being used for experiments. The concept of informed consent didn't exist yet. The mixing experiments themselves were done in the laboratory, but the context matters. During this same period, hundreds of patients were dying from incompatible transfusions as doctors tried desperately to save lives without understanding blood compatibility. Some of those deaths likely occurred during Landsteiner's research period, though the exact attribution is unclear from historical records. What Landsteiner discovered changed everything. He identified 3 blood groups initially, which he called A, B, and C. Later, C was renamed O, and a 4th type, AB, was discovered by his colleagues in 1902. Type A blood had A antigens on the red cells. Type B had B antigens. Type O had neither, and type AB had both. By 1910, blood typing before transfusions became possible, and by the 1920s, it was standard practice. Landsteiner won the Nobel Prize in 1930 and continued his distinguished career until 1943, when he died of a heart attack in his laboratory. He faced no consequences for experimenting on patients without their knowledge. Today, millions of people survive because doctors can safely match blood types before surgery and transfusions. Number 4. The malaria therapy experiments. Imagine being locked in a psychiatric hospital with a terminal brain disease. You're confused, maybe paralyzed, definitely dying. Then doctors tell you they have a cure. What they don't mention is that the cure involves deliberately infecting you with malaria and watching you suffer through weeks of fever so intense it might kill you. That's exactly what happened to hundreds of patients starting in 1917. Julius Wagner Jaureg was the director of the psychiatric clinic at the University of Vienna, one of the most respected psychiatrists in Austria. He'd been researching fever therapy for mental illness since 1887, and by 1917, he had a theory. Patients with general paresis, which is tertiary syphilis affecting the brain, were dying horrible deaths. The disease caused paralysis, dementia, and psychosis, and it was completely untreatable. But Wagner Jaureg believed that high fever could kill the syphilis bacteria in their brains. So he started deliberately infecting these dying psychiatric patients with malaria. The method was straightforward. He'd draw blood from a patient already infected with malaria, load it into a syringe, and inject it into a syphilis patient. Within 7 to 14 days, the malaria would take hold. Then came the fever protocol. Patients would spike fevers of 104 to 106 degrees Fahrenheit, over and over again. Each fever cycle lasted 10 to 12 hours and repeated every 48 to 72 hours. The plan called for 10 to 12 fever episodes before treatment. During these cycles, patients experienced violent shivering fits, drenching sweats, delirium, hallucinations, severe headaches, muscle pain, and nausea. Some had convulsions. The entire ordeal lasted 3 to 6 weeks. After enough fever cycles, Wagner Jaureg would administer quinine to kill the malaria. 15% of patients died during treatment, either from malaria complications, cardiac failure, or the sheer stress of repeated high fevers on their already weakened bodies. But here's the thing. It actually worked. 30 to 40% of patients went into complete remission from their syphilis symptoms. Another 30% showed partial improvement. Wagner Jaureg treated approximately 200 to 300 patients directly, and the technique spread worldwide through the 1920s. Tens of thousands received malaria therapy over the next 3 decades. In 1927, Wagner Jaureg won the Nobel Prize in Physiology or Medicine, the first psychiatrist ever to receive the honor. He continued as director until retirement, faced no legal consequences, and died in 1940, celebrated as a medical pioneer. The treatment remained standard until penicillin replaced it in the 1950s.